What is going on, you guys? Hey, it's Nurse Delore. It is a completely different time zone now. And when I say that, it's because I always feel like we're still stuck in April and March. Well, May's over, it's June now, so it's just been completely crazy. But I want to wish a lot of good luck to every nursing student out there who has already or is going to or has just received their results for their NCLEX. I know that you have all worked very hard to get to where you guys all want to be at this very moment, and just breathe. It's gonna be okay. Congratulations for those of you who have been passing. I've been seeing so many announcements on my nursing forums that I am a part of. Congratulations, you have all worked so hard and you all deserve this very moment to be about you. We need more of you in our field, so yes, congratulations. If you are still studying and say you still have some time, I have a couple of tips for you guys. And the program that I absolutely loved was Uworld. I absolutely felt prepared. I studied my butt off, and I didn't like Kaplan as much. It might work for some of you, but I found Kaplan to be too wordy and just not straightforward, and too many kinds of timelines that you had to meet. And it's not that I paid for the Kaplan, I actually paid for Uworld. I just had classmates that had Kaplan, and so I sort of got to see the program and how Kaplan kind of lays everything out for you to study and how the time frame should meet up before you get to the end of it. But I found Uworld to be more straightforward, quick, and I could just study on my own time, and it gave such good rationales after every single question. It gave pictures and you could save it, make note cards. It was fantastic. I want to say I paid $200 or $300 for a 3-month subscription. I don't remember, but they will list it all out on their website and app. You can access it from your phone, your laptop, your home computer, wherever you may be. You are always able to practice. I want to give a tip that practice questions are so important. And it's not so much about the question itself. It's about being able to do questions, right, for a long period of time. This is a 6-hour test that you guys are given. And you can finish in 1 hour, you can finish in 2 hours, you can finish in 3 hours, you don't know. But you have to be able to sit there and take a test. So 2, you want to already be in the mindset and the zone of answering question after question. If you cannot be in that mindset, then it's going to be a struggle. So Uworld was amazing because you could time yourself, you could give yourself a certain amount of time to do certain questions. You could pick different categories, or you could do all the categories. The way I did mine was, if I knew I was weaker at one subject, then I would go straight to that subject and do a couple practice questions a day. There were thousands of questions in there, you guys. I don't even remember. I must have done over 2,000 questions in a 1.5 month setting. I didn't rush myself to get the test done right away. I wanted to make sure I was prepared. Other students have different learning styles. Don't compare yourself to your classmates or other peers that you may have. That's not how this works. You want to do what works best for you and what's going to set you up for success, and not your friends, right? It's great to study with other people, I will say that, because when you are talking about questions and rationale, you are a little under pressure. You have to be accountable in your knowledge, and they can help talk and guide you through why the rationale you may have is right or wrong, or you vice versa for them. So with Uworld, what I did was I broke it down. I would do every day, I did at least 50 to 75 questions, and I would give myself time to take those questions, and then I would not read the rationale until I finished all of them. So I'd set my thing for maybe, let's say 75 questions. For some of you it might be too much, for some of you it's not, but that's really the minimum on your test anyways, because that's what you kind of want to set yourself up for, okay? As you all know, the NCLEX, you have a maximum amount and a minimum amount before your computer just basically shuts off on you. So you want to keep practicing that whole 75 minimum, okay? And then you can move it up to 200, 265, up to you. Next, you want to make sure you actually do go to the bathroom before you sit down and take your practice questions. But anyways, as you take your practice questions, go through all of them and answer each one. Don't look at the rationale or the answers until the end. Then you can go back, look at the rationale. If you need to write it down, write it down. If you need to make notes on it or flashcards, then do so. But at the end of the day, it's, do you understand why you got the question right or wrong? There's really no arguing on it. It's right or wrong. And they explain it so clearly, you guys are not gonna feel like it's your professor telling you. Trust me, Uworld's explanations make sense and they are clear. If there are some that are wrong, which tons and thousands of students will email the company, they go in, they fix it, and this stuff gets updated on a daily basis. So I did not find a single problem with mine. Secondly, when you find the answers and you're reading through the rationale, it makes so much sense on your topic of knowledge, what you know and you don't know. I know I was really weak at pediatric questions and OB questions. Those two were my least favorite subjects. I have always had experience with a geriatric adult population, so babies and children were not my thing, and I found it to be such a struggle. So I always made sure to brush up on those questions. Now, it kind of comes down to this. This is what will really help you guys pass your NCLEX, okay? The State Board of Nursing wants to know that you guys can be safe practicing nurses. Again, safe practicing nurses. The answers that you are choosing need to be the most safe answer that will keep your patient the most safe. I can't stress that enough. I can't say that word enough. Safe, safety, safe. The answers that keep your patient the most safe is like literally 99.99999% of the time the correct answer. Board of Nursing doesn't just want nurses that know their material. They don't want nurses that just know the content. Yeah, you will get questions that are very straightforward and you must know the answer, black and white, right? But then there are the SATA questions, select all that applies. The SATA questions are the more difficult ones. So the more SATAs you keep getting, the better you must be doing. So here's the line. You guys don't want to be hovering on this line. You don't want to be below the line because that's how you fail. So there's a line of passing that you guys need to keep going up and above. Okay, so when you're answering your questions, as you keep getting them right, you move up. If you get all of the base knowledge questions correct, like yes, there's only one answer, you stay on the line. If you're getting them wrong, you're going below the line. So you might have a little wave, but you want to have mostly up waves, okay? There's an algorithm to this that if you guys go online and read about the NCLEX, there's an algorithm. And so it's really unpredictable for people to figure it out. It's just whatever question you randomly get, always choose the question that is the most safe, okay? If you've got a math question, easy peasy, straightforward. If you have an ethics question, what's gonna keep your patient safe? If you have leadership questions, it's what is most rightful for a nurse to do that is not going to be against your scope of practice, harming the patient or yourself, okay? When you get more knowledge base, if you really don't know the answer, you could use your ABCs first. If ABCs don't apply to that question, it has nothing to do with it, the whole airway, breathing, circulation, then you're gonna want to use your Maslow's hierarchy. Is this a pain question? Is this a basic needs question? So kind of use that. If that doesn't apply, get rid of it. So those are the kinds of strategies and techniques you guys need to apply to these questions. You have to always make sure, though, that whatever answer you choose, it's gonna keep your patient, what's the word? Safe. Yay. Other than that, there's always a leaf and a stem part to the question. At least I think that's how they said it. But you really have to pick and choose what is this nursing question asking you and what answer do they want out of it, okay? So don't just read it forward and then look at the answers. Read it twice, read the question twice, and then look at the answers. Okay, because if you look at the answers, when you go back to read that question, you're going to make a biased judgment and you can base it off of what answers are below. So do that and then choose your answer. Static questions, I got 12, select all that applies. That is a lot. And I got 75 questions before my computer shut off. So I literally held my breath on the 74th question before I got to the 75th. I answered it, closed my eyes, clicked enter, and the freaking thing shut off. It could have either given me another question because the algorithm couldn't figure out if I passed or failed, or I completely bombed it. But 12 out of 75 questions is a lot of select all that applies. I just did my best and I felt that these questions were getting more and more difficult. So I knew I was doing good, but you just don't know when you get to the end, you guys. Okay, so I probably only got one math question. I mostly had leadership questions, OB, of course, OB. I had like an emergency room OB question. And I can't specifically give you guys any because I took this test a long time ago. As well, you sort of sign a paper that you will not talk and discuss about the questions. So I got that, and then a lot of the other ones were like med surg, basic knowledge, and so forth. I would also get questions about medications I didn't know about, I've never heard of, I couldn't even pronounce, but I did my best. And like I said, always use your nursing strategies. Is this an ABC question? Is this a life and death? Who's the priority? Are they asking me to prioritize which patient to see first? Always see your most critical patient, and you're using your ABCs: airway, breathing, and circulation. You will use your Maslow's hierarchy. Pain is a psychological question, but in reality of nursing, you always are seeing your patients in pain first because it's different. It's different in reality than what the ivory tower of nursing wants in the books, okay? So there's that. And then if it's a basic need, is this something that you need to do for the whole bathroom, potty, physical comfort, okay? So there's that. Uworld, you guys. At the end of Uworld, you get 2 exams. You get to take those exams and they sort of give you a prediction on how you're going to perform on your NCLEX. 100% every single student in my class that used Uworld said Uworld had way more difficult questions than the NCLEX itself. Remember, you guys, the NCLEX is made for a whole variety of students from all across the nation. So do difficult questions and you guys will be fine. Don't overthink it. Breathe. If you need to take the bathroom break, take it. But don't overthink. Don't sweat it. Just breathe through it. Answer questions in a logical way, because when you are stressed, what are you going to do? You're going to have a mind block. You're going to not be thinking clear or straight. Okay, so really breathe. Eat something before it. Keep your mind off of how all the other students in the room are doing, because they are there for other exams, other various reasons. And afterwards, treat yourself to a nice meal, sleep. You're gonna feel like vomiting, but I promise you guys will be okay. and I truly, truly believe this. I know that you are all going to do great, and even if you don't do great the first time, there's always a second time, okay? That's how we move on in life in general. You fall down, you get back up. You can't just stay down. You have to be your own motivation, and I am here rooting you guys on too, because I know you guys can do it. And I have felt and been where you are all at, and here I am now, a registered nurse. I can't tell you how grateful I am after I found out my passing results. I celebrated, but I didn't actually do something for myself yet. So I took myself to Hawaii. Luckily, it was my friend's wedding too, but I took myself to Hawaii as a graduation gift, even though it was at the end of the year. So other than that, good luck everyone. I know you guys got this. You can do it. Study, eat, exercise when you need to, and sleep before your exam. Please sleep 8 hours if you can. I know you guys are gonna feel anxious, but do it anyways. Personally for me, the way I prepared, I rented a hotel by my testing center because at the time it was kind of snowy and cold. I didn't want to be delayed in traffic or have an accident or a car problem. So I got a hotel room super close to the testing center. I ordered food, I had dinner. I studied only up until like 4 or 6 p.m. Took a hot bath with one of those fizzy bubblers, and I basically just treated myself, okay? And then I went to bed in my nice big comfy bed with all my pillows, and I was in and out of sleep the whole night because I was afraid I would miss my exam. My exam was scheduled for 8 a.m. I got up in the morning. Funny part, I forgot toothpaste. I was freaking out about it, so I just brushed my teeth with water and my electric toothbrush, but it was okay. And then I actually ate a caramel chocolate covered apple from Rocky Mountain Chocolate Factory, and then I had a little bit of coffee. I didn't have enough to where I would feel jittery and my heart would just be thumping through the test. I got ready, and then I went to a testing center. I got there and I sat in a room with a whole bunch of other nursing students, and we all just sort of talked to each other and what we were doing to prepare, and that we wished each other luck. And then when you get summoned and your name gets called, you go into the testing room, okay? So just breathe. You're all gonna do great, and I can't wait to hear that you have all passed, because I love seeing everyone's results on the nursing forums. But even if you don't, there's always a second chance, okay? Always. And you will get it the next time, okay? Just believe in yourself, have faith, and that's about it. Anyways, bye guys, and good luck.